Recognize the gentleman from North Carolina, Mr. Walker.
Thank you, Mr. Chairman. Secretary Wolf, thank you for testifying today. I appreciate your work over the last 4 months to help protect American safety. While the turnover in the department has been frustrating, that is no bearing on you, and we should be pulling for you and hope you do the very best job. And the evidence that we've seen so far is certainly to be commended, so thank you very much. We've heard a lot about the resources being allocated to screen for overseas travelers traveling through designated airports. However, there are still 700,000 approximately travelers who arrive daily through land ports and tens of thousands of others on passenger vessels. How is DHS, including CPB and the U.S. Coast Guard, working with the CDC to detect individuals entering the U.S. through land ports and waterways who may be carrying either this virus or something else?
So it's very similar to the procedures that we have at the 11 airports. So again, as you come into a land port of entry or even a maritime port of entry and you're coming into the U.S., you're going to see a CBP officer from an immigration perspective, and then you're going to go through this enhanced medical screening that we do at the 11 airports. We do a similar procedure at the land ports of entry, and then we'll, again, be referred to the CDC if needed. But again, our CBP officers do this on an everyday basis. So outside of coronavirus, going back 2 years, a year ago, they look at every individual, not only for immigration purposes, but to determine whether or not they may or may not be sick, and then of course refer them to secondary. So again, to answer your question though, specifically the measures that we have in place at the 11 airports that are screening, as I mentioned earlier, over 50,000 passengers. We continue to refuse entry to passengers that are on that 212F order. We have the same procedures in place at our land ports of entry, and of course the Coast Guard is doing that at our maritime.
Well, thank you for that. There are strong accusations that Iran, certainly China, and maybe other countries are covering up the full extent of the coronavirus outbreak in their country. And the numbers, as well as the numbers infected and death tolls, are significantly higher than reported by their government and health officials. In what ways is DHS combating disinformation and cover-ups from other countries to ensure both U.S. agency officials to make sure they have the necessary information to take the necessary reactive and proactive measures to ensure the outbreak does not occur? And I guess the second part is that to warn U.S. citizens about the risk of traveling to these locations.
Sure. So I'll take the second part first. There's a number of travel advisories that the administration has put in place to a number of countries. And so those are just advisories at the moment. So those are voluntary. Individuals can still travel to those locations, but they are being advised not to. Essential travel only in some cases, and then no travel in other cases. We continue to work with CDC and HHS, making sure that the medical professionals there understand what is occurring in China. So I know CDC, my understanding from the CDC is they have several individuals on the ground in China as part of a WTO team looking at that. I think there's always a question of whether the number of deaths are being underreported by China and the information coming from China is as transparent as we would like. So again, I would refer you to the CDC. They're the ones that are in constant contact with the medical professionals in China, trying to ascertain that information. And again, what we try to do is to make sure we support HHS and CDC. If they need to change their medical strategy, we change as a result of that.
CISA has stated that their team is closely monitoring the coronavirus and is working with critical infrastructure partners to prepare for possible disruptions that may stem from widespread illnesses. In 2017, DHS designated systems and networks used to administer elections as critical infrastructure and has since been one of CISA's highest priorities. With the elections today and many more in the coming weeks, do you have any plans to prevent any type of disruption?
Well, I think that's currently what we're doing. So we're not only doing that through CISA, they continue to look at the supply chain, they continue to look at the critical infrastructure to see about any slowdowns in that supply chain and how it affects, and we'll continue to look at that. And I would say, as we do across the board, not only with CISA, but with CBP, we continue to have all options on the table. So we are continuing to look at what we can do, and we'll, again, proactively take measures where needed.
Last question. Does the fact that areas of the United States have seen outbreaks, where those outbreaks have occurred, change your strategy in preventing the spread to other patients?
So again, we converse daily with CDC and HHS. Right now, we continue with the strategy that is in place. Obviously, we have a number of community spread and then person-to-person transmission as well. So the CDC is on site monitoring those. Again, from a DHS perspective, we're obviously very concerned about what's coming into the country. And then, of course, at TSA, you know, people are going to continue to travel inside the air transportation system. So what I will say is there's nothing that we're doing today that I'm announcing, but I will say that we continue to plan, the department continues to plan on all fronts for worst case scenario. So we continue to look at different procedures that we may have to put in place across our transportation system, across DHS facilities, should this continue to worsen.
Thank you, Mr. Chairman.